Wonderful. Thanks so much, and welcome again to the final session of the ASTHOConnects series on brain health. I'm Talia Sands, Director of Health Improvement at ASTHO. Over the course of the ASTHOConnects series, we have discussed the CDC and Alzheimer's Association Healthy Brain Initiative Roadmap, which is a guide to state and local public health agencies as far as how to address dementia. We've also, throughout the series, previewed the Roadmap for Indian Country, which was recently released. We've discussed data available about brain health from CDC and also heard case studies from states that are already working to implement the roadmap. On today's final session in the series, we hope to inspire you to implement at least one action step from the roadmap and to gain your commitment in learning more about brain health in your jurisdiction. Today's Ask the Experts virtual panel discussion will address questions that were submitted upon registration and other frequently asked questions. If you missed the first two sessions in the series, you can check those out on the ASTHO website where they're archived. For those who may not be familiar with ASTHO, let me tell you a bit about us. We are the national nonprofit organization representing public health agencies in the United States, the U.S. territories, and the District of Columbia, and the over 100,000 public health professionals that these agencies employ. ASTHO has three main functions. We are a leadership home for state and territorial health officials and agency leaders. We are an advocate and voice for state and territorial public health on Capitol Hill, and we are also a capacity building provider for state and territorial public health agencies. In today's final session, we will engage in a discussion with a moderator and three panelists. The moderator is Dr. Randall Williams, the director of the Missouri Department of Health and Human Services. We will also hear a national perspective from Meghan from Trust for America's Health, and then a state public health perspective from Rhonda Williams at the Vermont Department of Public Health. And last but not least, we are delighted to have Monica Hutt, the Commissioner of the Vermont Department of Disabilities, Aging, and Independent Living, also known as DAIL, join us to provide a state aging perspective. So to get us started, we want to do a quick poll of the audience to find out which frameworks you have heard about for supporting healthy aging or brain health in your jurisdiction. The answers or the questions will pop up on the screen momentarily. And what we'll ask you to respond to is whether you've heard of CDC's Healthy Brain Initiative Roadmap, the AARP Age-Friendly States Initiative, the Trust for America's Health Age-Friendly Public Health Systems Framework, or other. Vic, are you able to hold the poll up on the screen?
They are not launching, actually. Give me 1 second.
Okay, thank you very much. Well, we'll hang tight. Just to give you a heads up of where we'll go from here, I'll be turning it over to Dr. Williams from Missouri, who will moderate today's session. He'll do some introductions and guide the panelists through a series of questions, and then towards the end we'll have some additional time for questions. So at any point, feel free to jot some comments, feedback, questions into the chat box, and we can go from there. Any luck, Vic, or shall we
move forward a little bit, and then when I get them loaded in, sorry, Zoom is just giving me a little bit of trouble.
No problem.
Thank you.
All right.
Great. Then we'll go ahead and get started. Again, this is Randall Williams from Missouri, and greatly appreciate everybody engaging today, and especially want to thank our speakers. Again, I'm an obstetrician by training, and so I always used to tell patients that, you know, about the average age to live in the year 1900 was about 48, and now it's almost 80. And when you look at that statistic, it's really a triumph of public health. It was clean water and vaccinations and tobacco that were really, not tobacco, that would be the cessation of tobacco, and those kind of issues that have helped us live longer. But that also presents great challenges for us going forward, because some of the challenges we face now are probably not as simply addressed. But the principles we use, like we mentioned tobacco, in education and cessation are certainly ones that we can apply to all educational campaigns and interventions. And like so many things we do in public health, we often are working around public policy and being conveners, bringing people together. And so that's one reason we're very appreciative of the panelists today who can speak both from a national perspective, a state perspective, and a partner perspective, people who work in other, if you would, modalities or areas that they address it. And so, again, we're incredibly appreciative of that. I think the points that we want to emphasize today is that we hope all participants will be able to take away at least one point that they want to implement. Certainly, we want people to share successes and things that they're doing that we're engaged with today. So we're going to, again, be highlighting the Healthy Brain Initiative Roadmap. It has an action agenda of about 25 actions that you can take. And certainly during the course of this hour together, we'll talk about items that people have already instituted and other items that people may want to institute. I apologize. We're having a little technical difficulties here in Missouri, so cannot be accessible by video, but everybody else is. So we're going to start off with some initial remarks from each of the panelists and then move into conversation. And again, at any time, type in your comments or questions in the chat box. And really the purpose of this is to have an engaged conversation. From a national perspective, a key aspect of our progress toward improved brain health is developing a public health system that's dynamic and adapts. And so we're very appreciative to have Meghan Wolf from the Trust for America's Health, who's going to talk about the support of age-friendly public health systems. And her work supports state agencies to identify strategic policy, programs, and systems that we can change to create an age-friendly public health system. And they're currently convening a learning community in Florida, and she's going to speak more in depth about that. And again, we just greatly appreciate her taking the time. She has a strong background in public policy and advocacy, and specifically in education, which is certainly highlighted in the Healthy Brain Initiative Roadmap. So Meghan, again, thank you so much for joining us, and I'll turn it over to you.
Great. Thank you, Dr. Williams. I very much appreciate ASTHO's invitation to be part of this panel today and to share some of the great work that's happening in Florida through our initiative. So we call it the Age-Friendly Public Health Learning and Action Network because our object is to generate actions and changes in practice and policy through this initiative. And we're working with teams from 37 of Florida's 67 county health departments actively engaged in healthy aging. Since last October, TIFA has been supporting these teams as they explore how to expand their role, public health's role, in improving the health and well-being of the older adults in their communities. They're using new Aging in Florida data profiles created by the State Department of Health in response to this initiative. They're using those profiles to identify priority issue areas unique to their own communities. They're developing new partnerships and collaborations with the aging sector and other community-based organizations. And they're listening to the older adults in their communities about what matters to them. Many of them have identified mental health or even specifically Alzheimer's disease as the priority they want to work on through this initiative. And I can tell you that of the 37 county health departments, 24 have identified mental health as their top priority, and of those 14 have identified Alzheimer's disease as a top priority to work on in aging. And so we're helping them to explore what programs already exist, where the gaps are, and to help coordinate. As you know, public health, that's what they do. They convene and coordinate and collaborate, and really trying to break down the silos that often exist between agencies. So I'm really excited to share some more specifics about what we're doing in Florida a little bit later in response to some of the questions, but that's just my basic overview. Thanks again for having me.
Dr. Williams, are you still there? It looks like you may be on mute.
Hello, this is Randall. Can you hear me?
Yes, you're back on the line.
Oh, I'm sorry. Okay. Again, I apologize. And again, moving on to a state public health perspective, we think that in all we do in public health, there's always a great continuum between national and state and local, in addition to our partners. And so in Vermont, the public health and aging departments have partnered to ensure the health of those living with dementia is considered across both of these systems. So we very much appreciate Rhonda speaking to this. She's the Public Health Chronic Disease Prevention Chief for the Vermont Department of Health, where she works on a wide variety of public health priorities. And she started promoting brain health 2 years ago. And one thing, as you read the CDC's work, talking about the connection to other chronic diseases and population changes as they are expected to change in Vermont. So again, Rhonda, we very much appreciate your participation.
Thank you, Dr. Williams. There seems to be.
If you could just turn off the volume on your computer for while you're presenting, and then maybe that'll mitigate the feedback.
Okay, let's try this. Okay. Nope.
Vic, do you have any other suggestions for Rhonda?
Is there anybody else that's on the computer in the same room with you in the Zoom?
Are you on the phone and computer, Rhonda? I wonder if you're trying to speak through the phone, perhaps make sure that on your computer, the mute button is pressed on the Zoom platform.
That's perfect, Talia. Thank you.
No problem.
And then you'll have to dial *6 on your phone to unmute yourself.
Thank you so much.
Perfect.
My apologies for that. There we go. Okay. So I'm very happy to be here. Thank you, Dr. Williams. So as we recognize, Vermont is one of the oldest states and has the nation's highest death rate from Alzheimer's. So we're very aware of dementia's social, economic, and physical toll on our communities. Understanding the burden that this creates on Vermont's families and caregivers, we started a concerted effort to build on the state's strengths to create a state that is friendly at any age. For several years, we've been shifting toward a positive framework, using language around reframing aging and collaborating among our state agencies. We decided to create a feasible 2-year action plan among our public health and aging departments instead of updating a much larger and frankly unwieldy state dementia plan dated in 2008. We also recognize that the concern many Vermonters have about aging can be addressed through focusing on brain health versus an Alzheimer's epidemic. At the same time, our brain health efforts were starting to build. The health department started an initiative called 3-4-50, which highlights how lack of physical activity, poor nutrition, and smoking contribute to 4 major chronic diseases that that cause over 50% of our deaths in the state. This 3-4-50 initiative reaches across many sectors at the community level, organizational and towns, and invites their commitment to increasing these lifestyle activities, more exercise, better diet, and quitting smoking, that contribute to greater heart and brain health and cognitive decline risk factors. This appears to be resonating at the community and state level and opens up potential for state level policies and funding eventually to support and advance brain health. So for example, on the policy side, our work is aligning with the Governor's Task Force, Health and All Policies Task Force, in addressing 3 policy areas, healthy food access, transportation, and housing, which can align with our brain health efforts in decreasing poor nutrition, social isolation, and falls prevention. But I do think that it can be overwhelming on where to start as a health department, because it is a large issue. And the specific action items in HBI, I was much relieved when I started reviewing that, because they're concrete. They're easy to use to describe to a partner, and to select certain ones that match the strengths of who's at the table. Together with Dale, our aging unit, we've embraced that framework of brain health, which nicely matches their powerful reframing aging efforts. And I give a lot of credit to Monica and her team for positioning that so well through their work. And so to be able to recognize and build upon our departmental strengths into a fruitful collaboration does require spending time around the table, talking and planning. And I'm thankful that our colleagues at Dale are open to do this. This partnership also gives us support, and part of that is political support, to prioritize certain action as a health department. So one of them I just wanted to briefly mention was being able to prioritize, we hope, the caregiver module on our breakfast survey over the next several years, because we haven't yet been successful at that, and that's work yet to be done for us. So I'm going to conclude there and look forward to hearing from others and the rest of the conversation. Thank you.
Rhonda, thank you. And again, I think one thing that I found very interesting, again, is just the collaboration between you and the state aging agency. And so we, again, greatly appreciate Commissioner Hutt, who's been a champion for this and has done so many initiatives that often requires a champion. And she's going to tell us about the dynamic state systems that address quality of life and supportive services for caregivers. And I think a theme that you're seeing emerging is that perhaps in the public's mind in the past there's been this inevitable nature of what we're talking about, but I think what y'all are highlighting is certainly that it's a very different approach to look at this as brain health and prevention and care and wraparound services that you can provide that very much get away from that kind of inevitable nature. So Commissioner Hutt, thank you so much.
Thank you so much for having me. I would absolutely agree with what you just talked about, Dr. Williams. I think that for us in the State Unit on Aging, we also have all of our long-term services and supports in the same department, and it's really easy to get stuck in thinking about the acute care needs of this population. And it starts to feel a little bit inevitable and almost insurmountable when you think about the prevalence of Alzheimer's and the impact that has on both individuals and on their families. So what has been really valuable for us is this ability to partner with the Vermont Department of Health and to really leverage the work that they know so well how to do in terms of public messaging, in terms of a prevention focus. It's really hard to imagine talking about Alzheimer's and prevention But we know that what we can do is to try to get ahead of the game and to build across our communities an understanding of the importance of aging in a really healthy way, of keeping your body strong, of keeping your heart strong, and how much that contributes to strong brain health into your older years. And so with our partnership with VDH, with the Department of Health, it lets us think about that a little bit more and gets us out of our own acute care headset, which is sometimes really challenging. I think that we are able to leverage through VDH the communication capacity that they have, and together we've been able to really begin to market a different way of approaching the conversation in terms of healthy aging, talking about prevention, talking about 3-4-50, and it allows us to get ahead of ourselves a little bit, which has been so important. I know that Rhonda's going to talk a little bit further on about our hub and spoke approach, but this idea of really trying to push into the community and to create a community that's accepting and aware of the prevalence of Alzheimer's, to reduce the kind of stigma and isolation that both individuals and their caregivers feel is critical, because I don't think that we can take this on if we don't bring the community into the conversation. And that means that they need to recognize it and understand it at both a medical level, but also at a social and isolation level, and to try to mitigate that for people. So again, I'll stop there and look forward to the rest of the conversation.
Commissioner Hutt, thank you. And Kelsey, I think we're going to do a short poll here.
Yes, we have the poll from earlier geared up, and we have a second poll, so we'll have a back-to-back poll here. Vic, will you be able to do them here?
Yes, you should be prompted to vote on your screen now.
I'm not seeing it. Is anyone else seeing the poll?
Yes, I just saw it and voted on mine. And I see Carly, as other people are seeing it.
Great, thank you everyone. It might just be a technical issue on my end.
And people are commenting that it only allows for one response.
I'm seeing that folks are using more than one. That's definitely what we had expected, so sorry for the poll challenge there. And also seeing the addition of the Dementia-Friendly America.
We're going to move on into some questions, and maybe we'll come back and revisit that. But what stood out to you about the Healthy Brain Initiative Roadmap and its implementation in your jurisdiction? And please feel free to join in.
Well, this is Megan. I can start here. I think, you know, in general, the roadmap provides just a helpful framework for cross-sector efforts. We're learning in Florida that the collaborations and partnerships are really crucial to leverage limited capacity among all the agencies, particularly at the local public health level. And it's just such an integral part of the roadmap, the partnership aspect. And also the role in data and monitoring and evaluating that principle in the roadmap. All these elements are really essential and can be used for action planning, and that's kind of how we're seeing it implemented in Florida. But I just think overall, as a framework for cross-sector and multiple level collaborations, it's been really helpful.
Thank you. Anyone else? Were you aware of brain health before using the HBI roadmap?
I'm happy to jump in. I know that in working with the Department of Health, Dale and BDH really pulled, actually to answer your first question, Dr. Williams, we pulled a lot from the communication strategies that were part of the HBI roadmap and have really built those into our 2-year action plan. And probably the most valuable component for us here in Vermont.
The third question is one I'm very interested in that we have 150 local public health departments and many of them with different capacities. What is the first step interested state public health agencies can take to engage local public health agencies, which are often where kind of the rubber meets the road? I'd love for somebody to kind of help me with that.
I'm happy to answer that one again. Again, based on Florida, I mean the number one, I guess, kind of element in terms of engaging from state down to local was just setting this initiative as a priority and including an objective around older adult health and the state health improvement plan. I think those are the two key aspects of it. I think funding is always an issue, for local public health departments, but setting older adult health as an objective within the SHIP has been really instrumental and demonstrates the commitment at the top in Florida, so that the county health departments can kind of get on board and get in line with the project.
Is it safe to say that this is different enough for them that this is really probably going to have to come from the state? Or will many of them do this on their own volition?
It's in Florida. It's been interesting because the structure in Florida is that all the county health departments report directly to the State Department of Health. And so when the State Department of Health creates a priority, they are, pretty much going to fall in line, but it's not like that obviously in every state. And so I think it's going to vary. We're talking to some other states and communities where there's already a dynamic kind of brewing within the communities at the local level. And part of that is because they're involved in either dementia-friendly communities or age-friendly communities through the AARP. And so I think it really varies, but I do think it takes some commitment and some passion at some point by a leader either at the state level or within the community.
How about Vermont? What is y'all's structure in Vermont with the local health departments?
In Vermont, we are similar to Florida. We're a central system. So our offices of local health are part of extension of our work. And I would add, I think that what Meghan shared is really important. In our recent publication of our State Health Improvement Plan, we made it clear that this is contributing to healthy aging from the start, and that policies are to support the work at the community level. And so it's a joint effort, and over 100 stakeholders participated in that process. I'd also say that taking advantage of workforce development, both in ways that are formal and more informal, I have found that yes, webinars are one way, and we started doing that 2 years ago with our workforce. But I also found that making this a priority on the personal side of our work matches well with the professional, because people are often coming from both. There's so many of us who know someone or are caring for someone ourselves with a form of dementia. And so I find that acknowledging that and building upon that is generating interest in our workforce that is beyond, built upon the HBI, but is also a bit beyond it in terms of incorporating the personal.
Yeah, and just to highlight that, unlike some things we deal with in public health like Zika or Ebola, I think you'd be hard-pressed to find a family that's not affected some way by brain health and Alzheimer's. either directly or through a brother or sister whose in-laws are or something. So I think one strength to this is it is not something that is foreign to most people. What new vantage point has the roadmap given you and your colleagues? And again, that's an open question.
I'll jump in. This is Monica. I think that one of the things that we've learned and been able to really expand on is the idea of making the circle even bigger. And Rhonda can speak to this as well. You know, we're able to partner right now with our largest university, with their Center on Aging, and with our accountable care organization, who all have a real vested interest in addressing this issue. And I think that that idea of a partnership that ripples out to include additional leaders in the field that can really push it both academically and medically through the hospital. I think that that's been tremendous here in Vermont to bring the issue front and center and to make sure that there are resources allocated, at least in terms of time and thinking. We're not yet at the money stage part of it, but I think making sure that we've got the right thought leaders at the table to move forward an agenda across the state has been really powerful and important.
The next question, where do you forecast the state level systems going from here to support brain health? And I guess I would parenthetically say in this time of great interest in healthcare financing and healthcare reform, for those people who are thought leaders in this, are you hopeful in the direction, or are you concerned?
I would just add on this front that I think we are quite hopeful in Vermont. As Monica just mentioned, to have the leadership, the medical director of the Accountable Care Organization for our state, OneCare, at the table, looking at how they can be an active participant in building a model system of care that certainly is of value for any state, but certainly one that is rural, is a great indicator. I would also say that the Healthy Brain Initiative really by bringing together, braiding the evidence on why this is a public health priority and how to address it and to maximize impact is, I think, showing us how to do this through integration in our chronic disease work that will help our legislature understand that better, and I think over time help us to be successful in funding that acknowledges that the work can be done, is being done, but needs to be further expanded to match the burden that we're going to be facing as a state in multiple ways.
As a clinician, I was pretty amazed to see the statistic in the HBI that Alzheimer's is the most expensive disease in America. And I certainly, do you think your ACOs, do they kind of acknowledge that? And as they look at integrated systems, is that something that's kind of driving this?
I think that they do absolutely recognize that, and I think that they are also, again, Vermont is a small state, so we have the advantage of really being able to talk to each other and to sit at the same tables. But I think that the cost is not only a medical cost, but it's an economic cost, right? I think in terms of caregivers having to leave the workforce, or really the impoverishment of individuals who need to seek long-term services and supports. And so I think that the costs are really clear across all spectrums, both medical and the economic impact on the state as a whole. So I think that there is a real recognition of that, and that's why there's so much energy coming together.
And again, this question is for Vermont. How did you specifically use the HBI roadmap as a guidepost to address brain health in Vermont? I think you've answered that, but if you want to elaborate.
Yeah, I'll just add to what Monica said, that in the area of surveillance, it's certainly helpful, although I must say still not an easy one to accomplish when there's so much pressure on our breathless survey. But I can talk more about that later if that's of interest. In terms of communications, I found it to be very helpful. And we just recently completed another action plan for communications, so that with the assets that our communications office and the commissioner's office has, we're able to leverage through press releases. We're doing one with Dale in June for Brain Health Month. We are beginning social media, Facebook ads in June as well. And we are looking to our offices of local health and what they can do in terms of promoting brain health through their own channels. So I think that for us, at least, communications and the HBI have been a really good match.
And thank you for mentioning June. ASTHO is very purposeful, so it's great that we're discussing this just as we're approaching the month of June. We're going to switch a little bit here from using the HBI roadmap to the implementation of it. And for any of you, what advice do you have for other states to replicate your progress you've made towards improving brain health, and specifically one or two action items, perhaps from the 25 or others that you'd like to share?
I would say two really concrete and hopefully not too heavy a lift action items would be one, obviously the state health improvement plan and the planning process, and making sure to incorporate older adult health in that process, and incorporate and collaborate with aging sector in developing those plans. But also, I think that state can. It wouldn't be too hard a lift to make sure that your data systems include older adult health. I know Massachusetts and Rhode Island have some fantastic older adult health profiles that you can find online. And as I mentioned earlier, the Florida State Department of Health upgraded their charts system in collaboration with the Department of Elder Services, Department of Elder Affairs, in Florida, to kind of combine and integrate the data. So they took the data from Elder Affairs and then put it into the charts data system in Florida. So I think those are two really concrete and very helpful actions that states could do moving forward.
Hey. Megan, when I was a clinician, I had 3,000 patients, and obviously an obstetrician gynecologist, and so certainly the demographic that's often affected by Alzheimer's. And they would often call me thinking they were worried they were developing Alzheimer's, and recount they had lost their keys or something. Can you talk about age-friendly pilots in Florida that support brain health and cognitive functioning? Because it was something very much on my patients' minds after about age 55.
I can totally relate. Yeah, so there are several things that are happening at the local level that I think are really interesting and replicable. So one of them is just simply partnering with a partnership between a community care organization and the public health department to help man the special needs shelters during emergencies. Like during the last two hurricanes, the Palm Beach County Health Department partnered with the Alzheimer's Community Care Organization to provide care specifically for Alzheimer's patients and their caregivers. So that's a really concrete way of helping and partnering. Some of the county health departments are also delivering sensitivity training through, again, in partnership with the AAAs in their communities. But there's one activity I just found out about last week that's very, very interesting. One of our network teams in Manatee County, Florida, is partnering with Harvard Medical School on an initiative called Building a Brain Healthy Community, which is a multi-generational, community-based, longitudinal research study that's going to follow the residents of a particular community in Florida over a period of decades, to focus on developing studies and implementing actions and plans that will really identify factors associated with brain health and performance across the lifespan. Now, this is going to need some significant funding, and they don't have that all in place yet, but I just find it a really interesting and kind of definitely aligns with the roadmap, but this multi-generational lifespan approach to brain health that's going to be happening in Florida. So I just find that really interesting. I wanted to make sure I was able to share that today.
Yeah, I think that's very interesting too, because, you know, if you look at the roadmap, you know that this certainly can become issues for people in their 40s and 50s, and the sandwich generation is often dealing with and taking care of their parents. And so I think to have kind of that cross-generational, longitudinal approach to it makes a lot of sense. Again, a question for Vermont, especially in our rural states like Missouri. Transportation can add barriers. Can you tell us a little bit more about your hub and spoke model that tries to address those transportation barriers around integrating brain health?
Yes, so the hub and spoke model for the screening and diagnosis and more local care for those with dementia is inspired by the state's work over the last 5 or so years on hub and spoke for opioid addiction. And we are looking at the need for this, in part driven by data and providers saying that they're reluctant to perform the Medicare wellness benefit of screening and planning that it provides, in part due to they do that, and then what else? What next? And if that necessitates referral to the University of Vermont memory clinic, that can be a multi-month wait, 8 months or longer. So with that, and as Monica mentioned, partners around the table, including the Alzheimer's Association, OneCare, and others, is this possibility of building on assets. So it would require training in terms of being able to add capacity for it, but that training could include to psychiatric nurses, for example, as being part of expanding the ability to screen and diagnose and link to local care. So more practices locally could perform that and then refer to a regional hub, for example, for more in-depth dementia care. So we're still in the early planning stages, although making good progress, meeting every month or two to continue moving it forward.
Do you see a role for telemedicine, telehealth in this?
That's a great question. I do. I don't think our conversation has quite gotten there, but in other work that I am involved in, including in tobacco and asthma, that's certainly of great interest and focus. And it seems that we're poised to be able to take advantage of that in delivering specific and meaningful care by providers and their teams to those who face this transportation or other factors that prevent them from coming in for routine care.
Yeah, I often think, it can take so long to get into a specialist that so many people would just benefit from having a conversation via telemedicine just to answer some basic questions, some early screening. And so I think that's something that shows great promise. We're going to shift again into partnerships for brain health. And again, kind of want to look at some of those key areas as we try to convene partners that help you meet the needs of the state projects. And so we'll start off with Vermont again, talking about advocacy and leadership support for additional funding and staff capacity in Vermont.
So one of the aspects that has been really valuable in Vermont is the Governor's Commission on Alzheimer's and related dementia, where we're able to gather, and there is at least 12 different governor-appointed entities around the table, and some who are volunteering their time to set an advocacy agenda every year and to also educate key decision makers. So one year that was Lieutenant Governor, who became quite invested in the conversation and shared his own personal story related to dementia. So the commission also has two spots for appointed representatives, one from the House and the other from the Senate. That also helps to expand understanding through the legislature and also inform other commission members in what they face in funding and decision making and prioritization. While we haven't received any funding yet, there have been requests in the past for applying for or advocating for funding in the legislature to fund communications in particular. I just wanted to mention on the funding side of things, though, is that as a state, we are now facing higher thresholds in order to receive approval for going for funding. So in the past, we might have been able to apply for a $35,000, $50,000 grant, but that's now really the threshold, 75 or 100,000. And it's a struggle because those larger funding streams through grants don't come along very often for this type of work.
And again, Megan, if you, we may have touched on this, but the important role of local public health, and we haven't touched on area agencies for aging, which are vital here in Missouri. Can you speak to that a little bit?
Sure, and I think first off, just to share that one of the biggest surprises that we've had in working with the local public health departments and facilitating their work and having them like find a starting point even was that they did not know their aging sector partners in their communities. They didn't know their area agencies on aging. Many of them didn't know, even what they did or their connection with the State Department of Elder Affairs. And so that was really kind of an initial first step for them, is to just get in touch with their aging sector partners, figure out who they were and what they were doing. And because there are not AAAs in every community, they sometimes had to reach across the county border to figure out which of the AAAs actually serviced the older adults in their communities. And so once they began doing that and they began exploring how they could collaborate, a couple of the counties used the older adult health profiles to create issue briefs that they could then share with their AAA partners so that they could figure out, where are the gaps in services and where can they collaborate and coordinate, where can public health fill in some gaps where maybe the AAAs aren't able to do that, whether it's in meals, delivering nutritional meals, helping with some social isolation kinds of issues as well, because a lot of the Meals on Wheels folks, they serve a dual purpose, right? They deliver some of those congregate meals, but they also help to connect people and address some of those social isolation issues. So those are just some of the ways that they're beginning to work together. But again, the first step is just finding out who they are and making sure that they're connecting at some level.
Gotcha. Again, what recommendations do you have for other state public health agencies that are not as kind of evolved as y'all are in this for pitching their partnership to a aging department within their state government? Because they may say, wait a minute, this is kind of what we do. Why and how are you interested in this?
I think it's a really valuable question, and Monica and I talked about that earlier today. And I thought she said it so well, is that public health can really play the role of opening up the conversation by stating that and using data that's available, maybe even at the state level, in terms of why this is a public health priority, and what can we respectively bring to the table. Let's explore that in order to advance preparedness and in order to increase awareness. And through that, then there is more opening for planning, policy, and monitoring too. So I do see that the role of public health is using tools like HBI to make the case. One that I found very useful, for example, is that 95% of those with dementia have one or more other chronic conditions.
Yeah.
And that provides opportunity for us to look and see, okay, so how does our work roll up to reduce cognitive decline, and what can we do together even more powerfully with our Department of Aging?
And I would
Yeah,
just add, oh, I'm sorry. If I could just
No.
add one thing to that, Rhonda, I really appreciate what you said. And I think that it's important for public health to come in with a very humble perspective, knowing that your aging sector, your AAAs and councils on aging in your communities have been doing this work for a long time, and to come in as a partner, as the little brother, little sister kind of thing, and recognize the expertise that's already there, and just offer what public health is really good at doing, and not trying to take over.
Yeah, that's a great point. I mean, we have a little bit of a model for that for the opioid crisis. For years, that would have probably been within a state's behavioral health or mental health. And then obviously we've seen a movement in the last years now that it is the #1 public health crisis in America. So I think it's always a challenge as funding streams come in for state targeted response grants and things like that, that those who do the best are the ones who are able to partner well with each other and be respectful and sensitive to that. And I suspect the same thing's true for brain health and our councils of aging. I think it's a great point that we certainly have framework and probably skill sets that help. I think to approach that with a great degree of humility is probably very good advice. Commissioner Hutt, speaking of, y'all have a wealth of knowledge and expertise in aging. So you're obviously an incredible partner for those of us who are trying to kind of use our skill sets to make forays into this. Why do you think it's important to partner with public health?
Well, I think that Rhonda and Megan talked about this a little bit already. The reality of any public policy work is that you need to do the planning and the policy development. You need to have a pretty fleshed out platform before you can begin to seek funding to support the work. And I think that what Megan said is right. In the aging community, we know the work, and we maybe even know what needs to happen to support both individuals and their families, their caregivers. But what we don't typically have is a really strong communication platform. We typically don't have the expertise or even the human resources to do the kind of messaging. And that's, I think, where the partnership has been so profound. We are really able to work with VAH to imagine creating communities that are dementia friendly. And we talk a lot, Rhonda and I and the departments talk a lot about this idea of cognitive first aid. How do we create communities where people recognize what dementia is, what impacts it might be having on caregivers, and enables caregivers to access their communities more freely, knowing that there will be the kind of support that they need to be able to get out and about with their family members that might be diagnosed with dementia. I think we're really trying to focus on a dementia-capable workforce and pushing that messaging out. And so trying to draw people into the workforce also requires that kind of public outreach and public communication. So making this just a topic that's ubiquitous that we're all talking about in Vermont, that we understand at a deeper level than if it's not, than if it might not be touching us, but really understand what it means. I think that that's where the power of the partnership is. And then in creating that public conversation, that's what really drives the policy development and then the funding that follows that. But unless you have that kind of a groundswell, you aren't ever going to get to the funding pieces of it. It's too piecemeal. And typically, this is a population of individuals who aren't going to be able to advocate for themselves. Individuals with dementia are engaged in what they're needing to do to support themselves in the disease. And for caregivers, they don't have the time or the energy to do this kind of organizing. So I think utilizing what the association of, the Alzheimer's Association can do and what we can do in partnership with BDH, we need to be the voice for this in order to drive policy and the funding forward. And that's really the partnership piece.
Thank you. We have 5 minutes left, and the one thing I'm going to take, several things, but certainly you mentioned your lieutenant governor, and here in Missouri, Lieutenant Governor Kehoe is in charge of senior services. So I'm going to take to him today what you've been doing in Vermont and Florida, and certainly what ASTHO and the CDC are doing, and do a briefing on him on this. But if each of you could take 30 seconds and pretend you're speaking to Lieutenant Governor Kehoe, what would be your takeaway from this conversation, or in 30 seconds, what you would want him to know? We'll start with Vermont.
Well, I guess I would say this is a community issue, and if you look at the demographics across the country, it's going to be everybody's issue really soon if it isn't right now, and to not pay attention to this politically is short-sighted.
Perfect. All right.
I would say that there are assets to build upon in any state, and that in a leadership role like Lieutenant Governor, they can play a really instrumental role in identifying and building upon those assets to create a healthy aging state.
And I would just add to that to pay attention to your demographics. That really tells the whole story. Don't forget about your caregivers, and it's all about relationship. I mean, some of this work is going to move forward. It's all about establishing the right relationships, recognizing strengths, and where public health can fill in the gaps.
Well, certainly in public health, we think relationships are everything. Everything else is derivative. And we learned that at ASTHO, so I'll turn it over to ASTHO. But again, can't thank you enough. I learned an incredible amount. I am going to brief the Lieutenant Governor on this, and greatly appreciate your skill sets and your willingness to engage. So I'll turn it back over.
Thank you, Dr. Williams, and thank you to Monica, Meghan, and Rhonda for your insight. Really enjoyed listening to you all, and hope this is just the start of more conversations to come. Thank you to those who have joined for this session and for the other sessions in our series. We will have all posted on the ASTHO.org website very soon. And if you're looking for other ways to get involved with ASTHO's work in brain health, we are currently fielding applications from eligible states for a Healthy Brain Initiative Planning Lab beginning this fall in partnership with the Alzheimer's Association. Check out our website for more info or reach out to us if you have any questions. We are also set to publish some additional resources around brain health in the coming weeks, including a sketch video about brain health and an issue brief about caregiving. Continue to stay abreast of what's going on through the ASTHO Twitter and website, and to let us know if you have any questions or need any technical assistance. ASTHO is here to support you. And in our final moments, I will thank you again and also ask for your help in assisting us to improve future sessions by completing a brief evaluation. You'll find the link in the chat box shortly that my colleague will insert there. Please take a moment to share your feedback. We really value your input. And again, thank you to our panelists, the moderator, participants, and for your flexibility and patience with technology as we went a little bit rogue and went video only and slideless for this webinar. Thank you again. I hope you have a wonderful day, and please know that ASTHO is here to support you in your work in brain health. Take care, everyone.
Thank you.
Thank you.
Thank you.